Sohag Jewelers, timeless jewelry for generations.
Welcome to a live talk show, Life After COVID 19 Peak. We have Dr. Kusum Punjabi, who is emergency medicine physician at Robert Wood Johnson Hospital. Hello, Dr. Kusum. How are you?
Hi, Rashmi, and thank you, My Dream USA, for having me.
Thank you so much for taking our time, and Dr. Hats off to all our doctors who are taking out time. And I should say, you all put your life in danger. It's not easy. And हमें तो जैसे लगता है कि like when you're going outside, like oh my God, COVID-19, what's gonna happen? Should we go for grocery or not? But after knowing that your patients are suffering with COVID-19 and still you are doing like wonderful job, like मेरे पास तो शब्द ही नहीं है आपकी तारीफ करने के लिए. And
Thank
so
you.
much. तो इस तरह तो
Thank you.
डॉक्टर्स ही हमारे भगवान है, आई शुड से.
Thank you so much. आपको बता दूं, हम भी भगवान पे बहुत विश्वास करते हैं, and I'll tell you, it's the faith that's getting all of us going.
Of course, yes, of course, yes. So, of course, Dr. Kusum, the thing was, the show what we planned with you was what we were looking and what people were talking around that after taking precautions, like what instructions are being given, people are not taking that much of precaution which is required actually. Some people they feel kuch nahi hota, it's okay, doesn't matter. So I really want you to put some limelight on that. That what people should think about it, exactly what it is. Still, people are confused. I should say that.
Right, right. No, I'm so glad we're discussing this today because I just want to let you know, Rashmi, and for all the viewers and listeners, yesterday, one man went to a party in a beach house, okay, over the weekend. He was infected with coronavirus. He gave that to 30 other people that he met. They went back now to their homes and now they're going to spread it from there. The maximum number of deaths in coronavirus is within a family. So if one family member gets it, other people in the house get it, and the entire family gets wiped out. So I just want people to be aware that you could be going to someone's house for a party or a get together, right? And you don't even know who's carrying it because they don't look sick.
Yeah.
And if they don't look sick and they give it to you somehow, right? You're standing and talking, you're in an area where you're sharing drinks, sharing food, you can get the virus on you, but you're going to go home and make your family sick and people can literally die. So it's still extremely dangerous. We have to wear masks that cover our nose and mouth, and we have to keep distance. That has to still be happening.
Yes, and as our viewers knew that Dr. Kusum is coming on our show, they started calling us in our studio and they had so many questions. So today I'm going to ask all those questions because we have not kept the calls today. So उन सबके questions मैं आपसे पूछना चाहूँगी and
Sure.
I would like you to be more informative ताकि हम उन सबको मैसेज पहुंचा सकें and we would like all of our viewers to be very very precautious. That's what we want. So they have been asking that for a healthy person, how much risk it is for like with COVID-19.
Right. That's a great question. So, a healthy person, right, and even young people are not really at risk, okay, unless their immunity is down. So, for example, if I am sick and my immunity is down, right, I'm not going to be able to fight the virus as well as I want to. Now, different things can bring the immunity down, okay? It's not just cancer or disease. Your immunity can come down if you are stressed, right? If you're feeling mental stress, your immunity goes down.
Okay.
If you're not eating food that has good immunity boosters, like eating haldi, turmeric, right? Eating citrus fruits like oranges, eating in your daily diet magnesium and zinc vitamins. So if your food, आपके खाने से आपको immunity नहीं आती है,
Yeah.
even that can put you at high risk for the disease.
Oh.
So healthy people are at risk if the immune system goes down.
Oh. Now about the mask, they had so many questions. Oh my God, I just can't tell you. They are like, what type of mask are better for us? Shall we wear it? Shall we cover it with a simple cloth? What we should do? So please put some limelight on that also.
Sure, sure. So Any mask that covers your nose and your mouth is perfect. Anything. You can use a cloth, you can use paper, you can use one of those scarves, bandanas, anything that covers your nose and your mouth. Okay. Now, somebody asked me a question even before, can the virus enter from your eyes? It can, right? So if you're going to go to a crowded area, because any wet, moist mucous membrane, it can enter from. So in the ER, for example, in the hospital, I wear glasses, right? I wear goggles, clear goggles when I'm in direct contact with a COVID patient. Okay. When you're going to the grocery store, when you're going out for a walk, just wear a simple mask that covers your nose and your mouth. This way, nobody, if anybody coughs on you, right, accidentally, or sneezes on you accidentally, it is not entering you from your nose or your mouth. You're completely protected up here, and that's key.
Okay. And then we had one more question like, is COVID-19 causing more health issues?
That's a great question, and it is. Okay, what if I, if for those of you who've ever gone for a blood test, right, you see how your blood comes out into the tube. It's like a nice bright red color, and it just starts dripping like water. कोविड 19 में जब हम किसी का भी पेशेंट का खून ले रहे हैं फॉर टेस्टिंग, it looks literally like jello, thick jello. COVID causes tremendous clotting in the body, so people get heart attacks more, they get strokes more, they get blood clots in their arms, in their legs, and full arm and legs have to be cut off. Okay, and it's becoming really bad. So COVID can cause a lot more complications.
Yeah. Then they had question. This was also being asked a lot that hydrochloroquine and remdesivir, they were having high hopes with that. Now, what the thing is, because as you are a doctor, so you are more aware of what is upcoming with the vaccine, like because
Yes.
until the vaccine is not there, things are not under control.
Right. So, the two things. COVID is like any other virus, right? The treatment for a virus is essentially you go through the fever, you go through the symptoms that come, the cough, the runny nose, the sore throat, all of that. And then eventually you get better. Okay. So people who are sick, like people who have cancer, people who are old, who have diabetes, people who are very obese, right, very fat, they are very high risk of getting very sick with COVID. So those patients, right, we give them in the hospital hydrochloroquine, we're giving them remdesivir, we're giving them plasma, which is the blood portion of somebody who has recovered from COVID. They have very good fighting agents called antibodies. We're giving them that. And we're actually doing all kinds of other treatments for them. Now, if I go to a doctor's office and say I feel sick, I have a sore throat, do you think I have COVID? And the doctor tests me and they see I am COVID positive, that does not mean I need remdesivir or I need hydrochloroquine. That is only reserved for the patients who are very sick, who are in the hospital. Okay, so I don't want the common public who is outside of the hospital to be taking these medications, because then God forbid you need it and you come to the hospital, I have nothing to give you. Okay, so you do not need the medicines unless you are admitted to the hospital.
Okay. Perfect. So, and all the age groups are being affected. Before it was like youngsters and old age people and like 30s, 40s are okay. So, how is it like exactly? What is the scene?
Okay, that's a very good question. So, when COVID first came out in March, everyone said it's a disease of the elderly and it's a disease of people who are sick to begin with, right? People who have cancer, people who have diabetes, etc. But I'll tell you, in Central Jersey, where I work at Robert Wood Johnson Hospital, majority of our cases came from two groups. One was young men between the ages of 25 and 40. That group, men between the ages of 25 and 40. And the second group that was very sick was our nursing home patients. Okay, because nursing homes may not, they interact very close to each other, they live close to each other, the patients, so they were picking it up from each other and they were coming to the hospital. These were my sickest two groups. Then somewhere in early May, in literally 1 week, we had 5 children that were very sick between the ages of 5 years and 19 years. These children got high fevers and suddenly just collapsed. They just fell in front of their parents. And they came to the ER. Their blood pressure was very low. Their heart was not pumping. What COVID did in these children is it copied a virus called Coxsackie, which is a summer virus. And what it did was around the heart of these children, it went and formed a barrier. It formed inflammation, right? So the heart wouldn't beat. And if the heart doesn't beat, these children just collapsed. So it is now considered a disease of all age groups.
Oh, okay. So everybody has to be careful with this, right?
Yes, especially the elderly, especially the elderly.
And what is the right time they should go to the doctor? Like anybody is thinking that what symptoms are like should be there, or they should be precautions. Like this is the time we must connect to the doctor. And because I don't think so, it's wise enough that if you just start coughing and you're going to the doctor rushing there, it
Right.
doesn't make sense.
Right, right. You're absolutely right about that. Please do not be rushing to your doctor if you're not very sick. Okay, so let me tell you what the criteria is. In the spring and in the summer, right, we often get allergies, right? Your eyes itch, your nose itches. So you're going to end up getting a dry cough and sore throat. That is not COVID. Not COVID. Okay. COVID patients that get very sick have very high fevers. They have difficulty breathing. That's a very big sort of sign. They cannot smell, they cannot taste, and they have sore throat.
Oh,
Now, if you have no difficulty breathing, there is no reason to go to the hospital. Okay. If you have a high fever, you can take Tylenol or paracetamol, as they say in India. And if that brings your fever down and you're feeling better, you're good to go. If you are able to eat and drink and you're not vomiting, so you can drink water, you can drink liquids, you're absolutely fine. As long as you can get at least some liquids down, you can take the Tylenol, you do not need to go to a doctor. Okay. But once you start vomiting or you're having a hard time breathing, like even going from your bed to the bathroom, you're having a hard time breathing, please call 911 and immediately go to the hospital.
so I do have a lot of questions. I'm gonna take few only. I know everybody is like concerned right now, because
Sure, sure.
they really panic at this time. One of our viewer, she's saying like how to cope up with stress during COVID-19.
Yeah. You know, I used to tell people to deal with stress, hang out with other people, right? Be with your family, be with your friends, go to the mandir, go to the gym, right? That's the advice I used to give. But now, because all of these places are closed and we have to be very careful,
Yeah.
my biggest advice for stress is a couple things. First of all, you're not alone, right? You're not the only person here who is alone, who is sick, who is dying, right? No. The entire world is right now going through this with you. Please remember that, okay? Second thing is you have to implement in your daily routine some activity that allows you to go outside where there's not any people. Okay, so for example, please go for a walk, wear your mask, and go for a walk in your community, in your neighborhood, or drive to a nearby park where there's not a lot of people and walk there for 1 hour. That vitamin D, right, being in the sun, it is so good for your skin, your well-being, your spirit. And as you're going, listen to some good music and just feel good. Feel good that you're alive, you're not on a ventilator, breathe good air, and just feel thankful for that. Okay. Next, try to eat healthy food, right? Try to eat good food. Whenever you take some warm water, put a little bit of lemon juice, honey, and some turmeric. Try drinking that. It I can guarantee you it's better than any drink. You'll feel so good and soothing, and you'll just your spirit will feel better. Okay. And talk on the phone, right? Do Zoom calls with your family, your friends. Another thing that is really helping getting rid of stress is when you help the community. Okay. So for example, if you know there are elderly people in your neighborhood that don't have food, right, or can't go grocery shopping, help them, right? If you're good in stitching, make masks and donate that to shelters. Jabi, you help other people, right? Under say you feel happy,
Of course.
and that can really make you feel good.
So true. Absolutely right, doctor. That's such a lovely answer you've given. I really loved it, and I know सुन रहे हैं हमारा show देख रही है, and she will also feel very positive about it. It's so nice. Then I have a question: can the virus spread through asymptomatic patients?
Yes. The question is, can the virus spread from asymptomatic? Meaning, let's say, Rashmi ji, you and I meet or we are crossing paths in a grocery store. You don't look sick. I don't look sick. That means we are asymptomatic, means we are not coughing. We don't have high fevers. We're not shaking from shivering. That means we are asymptomatic, means no symptoms. We Also, if I happen to sneeze on you, or you happen to sneeze on me, or you sneeze on a container that I touch and then I touch my face, I can get COVID. Okay? Because if you don't know if you have COVID and I don't know if I have COVID and we interact with each other, we can spread it to each other.
Oh.
So, yes, COVID can spread from asymptomatic patients.
Um, One of our viewers saying that her son is going for on his job, so she's kind of worried. And what strict measure should working people take to stay safe?
Yeah. So, first, please assure that mother that all employers that are getting people back to work are taking a lot of precautions themselves. Okay. If your son is going to be using public transportation, ask him to wear a mask for sure, right? To enter the bus, the train, or even an Uber, right? You have to wear a mask if you want to go in this public transportation. He should try to wear gloves, carry a small hand sanitizer bottle in his pocket. As much as he can, try not to touch his face from ear to ear. So let's say he goes, doesn't have gloves, and he's in a bus or in a train. Once he reaches his work, really wash his hands with soap and water, then touch his face, then touch his mask. When he goes to his desk at work, right, he should use a hand sanitizer or big alcohol wipe and clean the entire computer, the desk where he is sitting. Because there's a cleaner, right? Like a housekeeping cleaner who comes and cleans the surfaces. We don't know if that person has COVID,
Yeah.
right? We don't know. So if that person touched the surface and COVID, they're saying, stays on the surface for about 8 hours, I don't want the son to get infected by touching that surface. So when I go to work, for example, in the ER, I right away clean my desk and my keyboard first, and then I sit there and then I work. Okay?
Yeah, one of the viewer has asked me that should I call my helping lady for work. So this is the answer you have to. She can of course connect with that. That it's better if you work yourself and
Yeah,
your life. That's much better. That's what
right,
I always feel. Yeah, that is so.
right. But Rashmi ji, they can have a cleaning lady come to the house, but make sure the cleaning lady is also wearing a mask, right? She's touching the surfaces and all, but just be aware, right? That if you don't know if she has it, right? So any surfaces that were not washed with soap and water, you can get it.
Of course, yes. And I have a question for you that there's such a thin line between a patient and a doctor. How you are working, how you are managing. Like I'm really worried about you too. You go
Oh,
to
thank you.
treat COVID-19 patients every day, and of course we are concerned about you. So what
Oh,
precautions you are taking and how you are managing?
thank you. So I'll tell you, this morning when I was finishing my shift at 6 o'clock in the morning, I had a patient from a nursing home that came. She was a 90-year-old woman who was COVID positive. She was tested at the nursing home 2 days ago and she was COVID positive. And she came in with severe difficulty breathing. She had the pneumonia all over her lungs, her COVID lungs. So the COVID pneumonia. When she came into the ER, before she even came there, and I knew she was coming, I wore the full gown. I had my N95 that sits very close to my face. On top of that, I had my surgical mask. I had my clear goggles, and then I had my hair tied up in a completely in the with a band at the bandana at the back. And on top of that, I had a shield that came in the front. And then with gloves, I went into the patient's room. So I had at least 5 layers of protection before I entered the patient's room. And when I came out of the patient's room, I removed everything, washed my hands with soap and water. Ghar aake bhi pura shower liya. So I'm being very, very careful because, you know, in March, April, and we were working with the patients, right? We were seeing 60, 70 patients a shift with COVID. And between each patient, we were completely wearing the equipment, then seeing the patient coming out, removing the equipment, then wearing the next equipment for the next patient. So we were in that habit now, right? But honestly, Rashmiji, if I don't want to die and I don't want to spread the disease, I have to do this. So we're doing it very, very carefully.
But it is so like it's so suffocating. It's not easy.
Yeah.
Like we wear masks just for like 30 minutes or an hour, and we feel so suffocated. Like oh my god, how you
Yeah.
manage? It's really like not easy. It's a task.
Yeah,
Task.
it is not easy. I'll tell you, in March, the N95 particularly is very tight. It sits right around here. It leaves marks on your face, marks on your nose. I was getting bruising on my nose. I had to put band-aids over here just so that the mask doesn't hurt me so hard. So it is very difficult. I'll tell you, I'm not going to sound like Jhansi Ki Rani, that, it was so easy and it was all easy.
Oh,
No, it was very difficult, and it is still very, very difficult. But honestly, if I don't do this, it's dangerous. And that is why I'm advising the viewers and the listeners, please be very careful if you want to live and not spread the disease to others. All you have to do is wear a simple mask like this just to cover your face, and that'll really help you.
wow, that's so nice, very informative, and I think so हमारे जो viewers सुन रहे हैं वो सब समझ रहे होंगे कि एक डॉक्टर के लिए कितना मुश्किल होता है, बट हमारी जान बचाने के लिए वो अपनी जान को जोखिम में डालते हैं, तो हमें उनकी जान बचाने के लिए अपनी जान संभाल के रखनी ताकि हम उनकी जान संभाल सकें.
Ah, thank you.
So, Dr. Kusum, as you are on our show, I really want to know a little bit about you. Like, was it your childhood dream to become a doctor? Please do share your journey also. I really want to know
Oh,
that.
so sweet. Yes, Rashmiji, I've grown up in Mumbai. I was there till I was 15 years old, and then we moved to America, to New Jersey. So I did my undergrad, medical school, everything here in New Jersey. I'm a New Jersey girl from for that manner. Um, I did always want to be a doctor. I enjoyed science a lot. And when I saw other people sick, it made me not feel comfortable. Like I wanted to help someone. Until today, that I don't know that बोलते ना भावना होती है किसी को दुख में देखते हैं I want to help, right? So I knew this specialty would be very good. Now emergency medicine is probably the best specialty for me to work in the ER, because whoever comes to the ER is at their sickest, right? They are in the most pain. They are in heart attack. Their heart has stopped beating. They are having a stroke. They are vomiting blood. They got a gunshot. They were in a car accident. Like we see the sickest of the sickest patients. And at that time, to be able to hold someone's hand, to make them feel good, to help them to take care of the disease, I really, really enjoy that.
Wow. And how your family is dealing at this time? Like when you go there, what they feel? They are so scared when you're going to treat
Yeah.
patients. So,
Yes,
आप हमारे viewers को इसके बारे में भी बताइए.
sure. So I'll tell you, one thing I really want people to believe in. You know, there is a higher power watching over all of us, right? कि कोई उनको अल्लाह बुलाता है, कोई उनको भगवान. You have different names for the high power. I definitely, before I go to work, I definitely pray to the high power that to protect me and protect my patients. I come home to my parents' house here in Jersey, and they are both in their 70s, and I definitely don't want them to get sick, right? So when I come back from work, I go straight into the guest bedroom, guest bath, take a full shower, and the clothes that I'm wearing, my scrubs, go straight into the laundry. Um, After I take my full shower, head to toe, then I come out and I interact with them, and we spend time together. There is definitely no hugging, no touching. We all have our own spoons. We're not sharing food from the same plate. And these precautions we've been doing since March. So we have to, and I think for the rest of the year, I'm going to continue it. Because see, if I go to work and happen to pick up the virus from someone, or if I go on the bus or the train, or if I go to a grocery store and I happen to pick it up, I still don't know if I'm carrying the symptoms or not, right? I can still be an asymptomatic carrier. So I can't risk my parents' health with that, right? Or my loved ones. So we are still all using our precautions of using our own utensils and very minimum touching, physical touching, as much as we can. If I use the computer at home, I completely wipe it down with alcohol swabs and with sanitizers before my mother or my father use it.
Yeah. So you have been dealing with COVID patients from day one. So,
Yes.
what do you feel now? What is the situation, and what do you think in upcoming month or two how the situation will be?
Great. So I'll tell you, when the situation started in March, we were not prepared, right? Like we did not know, and we were seeing 60 to 70 patients a shift in a 12-hour shift. Imagine, I was seeing like at least 5 patients every hour that were very, very sick with COVID. They were all either getting oxygen on their nose or on a mask. They were getting oxygen from that, or I was putting a tube down their throat and connecting them to a ventilator. So people were very sick. This continued till somewhere between end of April. We were seeing like high numbers every day. After end of April, now all of May and now the beginning of June, the numbers have gone down drastically. Okay, and the number of COVID patients. There is still COVID positive carriers, but the number of sick COVID patients has gone down. Okay, so I'm still, if I let's say somebody comes to the ER because they're having chest pain, right? A totally different complaint, and I get them admitted for chest pain to get a stress test or jo bhi karna ho. In that patient, if I do a COVID test, it comes back positive. Okay, but they're not sick with COVID. They don't have the COVID pneumonias or the fevers, so that's still very scary. So that's why I want the viewers to know there are still people out there with COVID. You can still get sick with COVID. You have to still maintain wearing the mask and keeping your distance, because you don't know until the vaccine doesn't come out, which will probably be in early 2021 or late 2020. You have to be careful. Also, coming September, October, the flu season starts, right? So you'll be very, very careful. Get the flu vaccine for sure, because flu and COVID, if you get together, you can be very sick. You can die. So you'll be very, very careful.
That's very informative for our viewers. It's a very good information you have given that for the flu they should get the vaccine. It's very important.
Yes.
Doctor, as you've been dealing with COVID patients, what is their mental status when they come to you? Like, it's really, they must be disturbed. Like, how you deal with them, it must be so difficult.
Yeah, it is very difficult, I'll tell you. And that is why I think, Rashmi ji, for me, COVID has been the toughest part of my career. You know, I worked through SARS, Hurricane Sandy, Ebola. I never saw that many patients. And every time a patient came to the hospital, right, they had their family with them. With COVID, it's a no visitor policy, right? So the moment you get very sick, your family has to leave you at the door, and that's it. You're going to be taken care of by complete strangers, right? The doctors, the nurses, you don't know them at all. So you're alone in your room. Everyone is scared of coming to you, right? They're going to take care of you, but you're alone. And I think that is really making people very scared about the disease, right? And when they come to the ER, I can see it in their eyes. There's so much fear, so much fear. That is why, I wear gloves, I wear my goggles, I touch their hands, I tell them it's going to be okay, and we take very good care of the patients. But the fear of the patient, it definitely comes on us.
Of course, of course. I know it's a tough task, Dr. Kusum, and you're doing a wonderful job. Matlab, mere paas to again, I'm telling you, I'm speechless. Matlab, thank you is very small word for you, that what you're doing for all of us. It's great,
Thank you.
I'll say, amazing. And
Thank you.
before we end the show, I would like you to say something to our viewers. More information, I would like. More information. I'm just trying to help them out so that they are more precautious, and they don't have
Sure.
to go to hospital.
Sure. So I would really urge everyone to, अगर आपको आदत नहीं है news देखना, please at least see the news every day so you're understanding the guidelines. So right now, the latest guidelines as of today, June 8th, you can meet people in an indoor setting up to 10 people wearing masks. Okay? You can have people in your backyard up to 25 people wearing masks. Okay, so please make sure, I really want the viewers to follow those guidelines. You don't get into trouble, right? Don't go to any big gatherings where police gets called and you get into trouble. So please, viewers, remember that. Okay, read the news, see what the latest guidelines are, and please follow the guidelines. Second advice I want to give is that, please, you don't know who has COVID and who doesn't. And I'll tell you, because there's such a fear of COVID, koi COVID test positive bhi aata hai na, they will not tell people, right? If they're not sick. So please just assume everybody has COVID. Just assume. And that is why wear your mask, wear your gloves, keep your distance, and really be careful for your own health. This is a small period in our life. We'll all remember 2020, but we'll all pass through it. And 2021 will be great because we'll survive this together. Just take the precautions, please.
Yeah, and they're very simple precautions. Everybody can manage it so easily.
Yes.
Save everybody's life, of course. And thank you, Dr. Kusum. It was great talking to you. बहुत अच्छा लगा आपसे बात करके और आपने हमारे व्यूअर्स को बहुत कुछ बताया और समझाया. Thank you so much.
Thank you so much for having me, Rashmi ji, and thank you, Dream USA.